The Misericordia is an organization, I think, that's time has come.
We're on the map now, and I think that's a good thing. That's a good progression, and I think we need to see that as a facility that we are doing and making differences.
It comes back to the roots of how this institution began in the late 1800s when the Sisters of Misericordia saw a need in the community to help unwed mothers care for their children. And it was really done out of compassion. And I think that thread has remained within the fabric of the Misericordia Health Center.
Healthcare for seniors, eye care, these are critical things in today's society.
We're adding new programs, we're moving forward, we're advancing, we're making a difference.
The Eye Center, it's an incredible organization. It's the largest in Western Canada.
All of us go through the eye clinic in one point in our lives, whether we've had injury, whether we're aging, whether we're diabetic.
My brother had 2 corneal transplant surgeries here, and my father, since that time, had glaucoma surgery. On that basis, I felt a very strong connection and wanted to be part of it and make a difference.
It motivates me to build a place where I know that my family and my kids could come.
A place where people can come to live that need a little more care than they can actually get out in the community in their homes. We try to provide that care in a very respectful way, a resident-focused way, and in a very sensitive way so that the residents themselves will have a say in their care planning.
We become a community with them. They get to know our healthcare aides very well, our nurses very well. I get to see these faces on a very regular basis. We come from the heart.
That's what makes this center so unique, is really this kind of collective feeling that you're part of a bigger whole and that you're able to make a big difference in the community.
The Winnipeg Regional Health Authority can't fund everything. The small donations that we can receive can really make a difference, that make people's lives easier, makes the discovery of their malady that much easier to diagnose.
One of the things that is part of our base funding is certain equipment so that we can provide the care to our residents, but what the foundation does is it might provide us some added pieces of equipment.
Donors are part of what keeps us going and help us achieve the best care that we can possibly provide for somebody.
Individuals or corporations, but in most cases individuals, often connect with charities and with organizations because they've had a personal experience.
Dr. Mathen had done surgery on my father years ago, and he was on the radio just speaking how they needed more equipment. And John, he heard the doctor talking and made a phone call.
It just feels good to give to an organization that puts the money to good use, and we feel that the Misericordia puts the donation money to good use.
You know, once we've engaged the donor on why this is such a special place and why it needs to continue to thrive, is showing them firsthand that their donor dollars are being well spent. We're custodians of their gift. You'll see some rooms that are recognized and named as a result of specific donations that have come in from donors. Through various levels of donation and contribution, you know, we make a strong effort to recognize those that have contributed and made a donation to the health center.
They're so dedicated to the work that they do that it seems to encourage us to help.
We can't ride bicycles across the country to raise money, and we can't walk across the country to raise money, so it's the only thing we can do.
There's an easy way to do it.
Yeah.
We try to connect people personally with various projects. We really want to make that direct connection between the donor and the end result.
It's going to be the hundreds and hundreds of donations from just everyday people that is going to make the difference.
It's exciting to see what the ideas and thoughts are and how we're going to be changing. And I guess that, you know, with healthcare, everything changes, and so should we as a facility. And I think there's some really cool ideas that are coming out of what we're going to look like in the future.
It's been a real kind of evolution. Is the founding roots of the healthcare center through the Sisters of Misericordia is really one that's strongly connected to the Catholic Church and the Catholic faith. But that again goes back to this compassionate approach to healthcare that is all-inclusive. We are reaching out to a very broad-based and diverse group of people. They're all welcome to be part of the Misericordia family.
If somebody were to come to me and say that I'm really thinking of donating at the Misericordia Hospital, it would be easy. It's a no-brainer.
It comes back to you tenfold. It's hard to believe, and we don't do it for that reason.
The older we get, the more we realize the importance of helping institutions develop.
It's a thrill for us to see behind the scenes and be able to see the machinery at work and the doctors at work.
I've worked with a lot of companies and a lot of nonprofit organizations and for-profit organizations, and just the level of commitment and engagement here is above and beyond anything I've ever seen.
Misericordia Health Center, the time has come. It is the time, it is the place that you should consider donating to.
We're so thankful that we have people out there with huge hearts and they're willing to donate.
We want to be the best, and they make us the best.